For edifying and refreshing contents, watch Revival in Reformation Television. You will not be disappointed. Welcome to Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy. Let's join the discussion now. God bless you.
Greetings, precious viewers. You're welcome to Health Matters. How are we doing? I hope we're taking water like we told you at the last episode about you taking water regularly. We have a fantastic topic again today, very important one that we believe will be a blessing to all of us. Again with me today is our precious First Lady, medical doctor, a senior registrar with Lagos State Teaching Hospital here in Lagos, in Ikeja. She is in the Department of Anesthesia. She's the First Lady of Love Squad Community Church, Okwebi, Lagos. Please join me as I welcome once again to this program Dr. Mrs. Ayobami Oyedepo.
Thank you.
You're welcome.
Thank you. Thank you very much.
Thank you so much for the exposition at the last episode. I was personally blessed, especially that area about filtering of the kidney. Can you quickly just give us a small recap about the benefits of water we did last week before we go to this?
Okay, thank you, Ma. So we mentioned a lot of things about the benefits of water, talked about how water is important to keep us active during the day. You don't feel blurry, foggy, and all of that. Water helps to maintain blood volume in the body, quite important, so that the heart would have enough volume to push around the body. And also talking about the kidneys, how water is important for the function of the kidney in order to filter waste products out of the body. And when this is not done, we mentioned the possibility of having what we call kidney stones, when the kidney cannot filter the waste product as it should, so the product can clog the pores, let me put it that way, the pores that the kidney is using for the filtration, so you can have the kidney stones. Then also something that I forgot to mention the last episode about this water is that when you are being dehydrated, there are some signs that you would also see to let you know that you are not taking enough water. So when the quantity, the volume of your urine, you are noticing that the volume of the urine is reducing, it is not the way you normally urinate, it might be an indicator to tell you that you are not taking enough water, so your kidney does not also have enough to push out. Another thing also is the color of the urine, how concentrated the urine is. When you are passing urine that is concentrated, that is very dark, it can also be an indicator that you've not been taking enough water. When you take enough water, the kidney would have enough to use to filter the waste product, and the clearer the color of the urine would be. So those are some of the things I think would also help us to keep track, to know that we are not doing well or you are not doing enough when it comes to you taking water. Thank you.
Thank you for the extra. Thank you for that important extra. So let's go right into today's topic. Flu. What is flu? How do we know we have flu? You know, in this part of the world, in the tropics, we don't really, we feel, most of the time, I think we talk about malaria, that we have malaria, but it so happens that we have what is flu. There are times that it is flu we have and we think we have malaria. So, doctor, we're going to start, first of all, from telling us, what is flu? do we have flu in Nigeria? Can we have flu?
Okay, thank you. Thank you, Ma. So flu, I would say that it's a viral, is a respiratory infection caused by a virus. So usually by the influenza virus. So it affects the respiratory system starting from the nose, can affect the nose where you have runny nose, can affect the throat where you have the sore throat, can affect the eyes and the ears also. So usually around the head, so it can affect the nose, the throat, the ears, the eyes. Then when it's now, maybe if there is a superimposed infection or in the severe form of it, it can then affect the lungs. That means it travels down to affect the lungs. So it is a respiratory system problem.
Do we have it in Nigeria?
Yeah, yes, it's a virus, and it's like in our books we say that viruses are ubiquitous. That means they can be found anywhere. They
So
can
we
be
do
found.
have flu.
Yes.
So anytime we are having cold, catarrh, like we call it here, that means we have flu.
Yes, it's
And is it
usually
malaria? Is it malaria?
no flu is not malaria. So
And it cannot end up being malaria.
it cannot end up being malaria, but the truth is that you could have malaria with it, but it is not the flu that has then metamorphosed into malaria. No, they are caused by two different things. Flu is caused by the influenza virus. Malaria is caused by the Plasmodium species. So they are two different things. But of course, the one could assist the other. For example, maybe you are already having the symptoms of malaria, you're already having the Malay fever, but you are still keeping it strong. So when you now had stress and all of that, combined with the fact that your immune system is already compromised, then it will be easier for the virus, the influenza virus, to now attack, and you come down with the flu. So it can happen, would I say pari passu, but it is not caused by the same organism.
Okay.
Yes.
What are the symptoms of flu? How would our viewers know that I have flu? This is not malaria, this is flu. How do we know? What are the symptoms? What are the signs?
Okay, so for flu, like I mentioned earlier, it affects the nose, the throat, the ears, eyes, and so those are the usual parts of the body it affects. So when you have flu, the commonest presentation symptom is the running nose.
Okay.
That's
catarrh.
That's catarrh. That's the commonest presentation of it. You have the running nose, then you can go further by some people. Without the catarrh, they can have the sore throat. So you have pain on swallowing and all of that. So painful swallowing, you have sore throat, you feel like you have wounds in your throat. So then here there could be ear pain. Also sometimes the runny nose would have started before you now start having the ear pains with it. So those are usually some of the symptoms. Then there could be fever, and the fever is plus or minus. For some, there won't be fever, you just have that the catarrh, the sore throat, yes, and at times too you can have fever with it. Yes. Yes, you can come with cough, yes. Anything, all those presentations are for the respiratory system, so you can also come with cough. And any one can precede the other. It's just that the running nose is the most prevalent way of presentation with the influenza virus.
Does it affect both young and adults? That is, children can have flu, adults can have flu.
Yes, it's anyone, young adults and but it's commoner among the young children because they don't know about the precautions. They throw precautions into the hair and all of that. So that's why the presentation is more amongst them. Then they are almost always with their colleagues in school and all of that. So tend to have it more amongst them, but it can also affect adults.
Okay, you just mentioned it now. What are the ways that we could prevent, before we go to how to treat it, how can we prevent ourselves from, this virus? How can we prevent ourselves from, flu?
Okay, so for the prevention of flu, it's okay. I will take it in two different ways.
Okay.
Meaning your responsibility to yourself when you have the flu. Meaning that when you have the flu and you are trying to prevent other people from getting it. So that's what I'm saying. I'm taking it. So prevention, first part, you preventing yourself from having it. Then the other part is you have the flu, but you are conscious of the people around you. You want to prevent others from getting from you. Yes. So
first of all, the first part.
So you preventing yourself from having it. First thing, we need to pay attention to our immune system. We need to eat healthy. You need to ensure that at every point in time, or as much as you can, you try to ensure that your immune system is on point. You eat healthy, you sleep well, you drink water in healthy manner and all of that, because usually this virus, influenza virus, it's easier for it to affect a person that already has a compromised immune system. So when your immune system is on point, even when you want to have it, your body will be able to fight it. But when the immune system is down, then when the virus comes in, it's have the whole room, it has the whole body to itself to.
That's a free day.
Yes, in the system. But when the immune system, you are on point, you are taking fruits well, taking vegetables and all of that. So even when you are exposed to it, the body natural immune system would help to fight it.
Okay.
So that is one way.
Immune system must.
Yes, ma'am.
Okay.
So that's one way we can prevent that. Then also hand washing with soap and water. The importance of this cannot be overemphasized.
I like when you said with soap.
With soap and water. So it's not just rinsing the hand with water. Hand washing with soap and water. Very, very key, very important. So we go about our daily activities. You touch surfaces, you touch doorknobs, you touch things that you don't know the last person that touched it, if the person had passed on any droplets from the nose, any viral droplets and all that thing. But when we have that, when we imbibe that culture of hand washing, yes, and that was one thing that really helped during the COVID era, the hand washing with soap and water. I think we need to go back to that and teach our children also the importance of this. So that also helps. Then another thing that helps is you not touching, how would I put it, not touching your nose, your eyes, and indiscriminately. For example, you've done so many things and you are just using that same hand that you don't even know what you yourself you are carrying already. You just put that hand into your nose, or you put the hand, you keep scratching the eyes and all of that. So just by yourself, you might have introduced the virus into those parts of your body. So yes, the touching you, we must be careful, because the last handshake you had, you don't know if you had actually taken up one or two viruses from the person and all of that. So we need to be careful on the way we touch our eyes indiscriminately. You put your hand into your nose and all of that. So that also is another way of preventing it. Then when you get to your space, maybe your office, your house, we ensure that your surfaces, you sanitize your
Clean.
yes, so you clean your surface, you sanitize, you can use the hand sanitizer or surface sanitizer,
To clean.
yes, to clean the surfaces around you, maybe your workstation or your homes. So that also helps to prevent this virus. So those are some of the ways that we can actually prevent having it. So the other one that I said, I'll take it into the part of you having it, but you are trying to prevent others from getting it from you. So that's what the cough etiquette is very important when it comes to that.
Please explain to us.
So the cough etiquette is when you want to cough, when you want to sneeze, you either do it into a cloth, as in your handkerchief or something.
Can you just demonstrate?
Okay, so for example, if I want to sneeze now, I have this with me. So I sneeze into it or I sneeze into my sleeves. Either of those two. If you want to sneeze, if you want to cough, so you do it in the not just into the air. You just don't sneeze into the atmosphere, releasing droplets and all. Then you sneeze into. So we usually discourage sneezing into the palms, because when you sneeze into your hand without you probably washing the hand, you can touch anything. You can touch surfaces. You can touch doorknobs, and the next person coming can pick it from there. So we usually discourage sneezing into the palm. We tell children that also, that you sneeze into your elbow. We tell them elbow, sneeze into your so it's more difficult to have it spread from there than your hand. Your hand, you could offer someone a handshake. You could touch surfaces that another person is also coming to touch. But when you do it into your sleeve, the possibility of having it actually reduced to the barest minimum than into your handkerchief. So into your handkerchief, you can do that. Then you can be kept in your pocket that way. Then also the use of our face mask is still important.
Very relevant now.
It
very,
is.
very.
So when you have the flu, you might want to go around with your mask, so that when you at least do any of the sneezing, or it is well covered. It is not into the air, it's not into the atmosphere that people next to you might pick it from. Then at the same time too, when we're around sick people, that's for when we don't want to have the virus, you can also use your mask when someone has the flu around you, someone is sick, to protect yourself from getting it. You can also both ways, you go for both ways. It's either you are preventing it from getting to you, or you have it already and you want to make sure it stops with you. You don't want to spread it to others around you. So the face mask helps with that.
Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy. This is Revival and Reformation Television. Keep watching. Thanks for watching Revival and Reformation Television.